Question 1. Consider a scenario where a certified diabetes care and education specialist, CD says, is working with a new patient who is of Southeast Asian descent and has recently been diagnosed with type 2 diabetes. The patient expresses a strong preference for traditional family meals, which often include rice as a staple, stir-fried dishes with sauces, and various fried snacks. CD says needs to provide education on the role of macronutrients in managing blood glucose levels. Which of the following approaches best reflects culturally sensitive and effective diabetes education regarding macronutrient intake? Option A. Providing a generic meal plan that emphasizes a fixed ratio of carbohydrates, proteins, and fats, without inquiring about the patient's typical dietary patterns or cultural food preferences. Option B. Discussing how to incorporate smaller portions of rice, choose brown rice when available, and explore leaner protein options and non-starchy vegetables to balance the meal, while also explaining how sauces can impact carbohydrate and sodium intake. Option C. Immediately advising the patient to eliminate rice and fried foods from their diet and replace them with low-carbohydrate alternatives to strictly adhere to a ketogenic eating pattern. Option D. Suggesting that traditional Southeast Asian cuisine is inherently unhealthy for individuals with diabetes and recommending that the patient adopt a Western-style diet consisting primarily of grilled meats and salads. The correct answer is B. Discussing how to incorporate smaller portions of rice, choose brown rice when available, and explore leaner protein options and non-starchy vegetables to balance the meal, while also explaining how sauces can impact carbohydrate and sodium intake. Explanation. This scenario presents a common challenge for certified diabetes care and education specialists, CD says, in navigating individual patient needs within established dietary guidelines. The challenge lies in translating general macronutrient recommendations into practical, personalized advice that respects a patient's cultural background and preferences, while still promoting optimal glycemic control and overall health. A CD says must balance evidence-based practice with patient-centered care, ensuring that recommendations are not only scientifically sound, but also culturally sensitive and achievable. The correct approach emphasizes a collaborative and individualized strategy. By engaging the patient in a discussion about their cultural food practices and preferences, the CD says can identify opportunities to integrate diabetes-friendly modifications. This approach aligns with ethical principles of patient autonomy and respect for diversity. It also reflects best professional practice as outlined by the American Association of Diabetes Care and Education Specialists, AA Diabetes Care and Education Specialists, standards of practice, which advocate for personalized education and culturally appropriate interventions. This method ensures that the patient feels heard and empowered, increasing the likelihood of adherence and positive health outcomes. An incorrect approach that solely focuses on generic macronutrient ratios without considering the patient's cultural context fails to acknowledge the importance of cultural competence in healthcare. This can lead to recommendations that are perceived as irrelevant or unattainable, potentially causing frustration and disengagement. Ethically, this approach may violate the principle of beneficence by not providing the most effective and sustainable care plan for the individual. It also risks alienating the patient and undermining the therapeutic relationship. Another incorrect approach that imposes a rigid dietary plan without exploring the patient's existing eating habits is equally problematic. This demonstrates a lack of patient-centeredness and can be perceived as authoritarian. Such an approach disregards the patient's lived experience and may not account for the practicalities of their daily life, leading to non-adherence and potential feelings of failure. From a regulatory perspective, while not a direct violation of a specific law, it falls short of the professional standards expected of a CD says to provide tailored and supportive education. A third incorrect approach that dismisses the patient's cultural food preferences as unhealthy without exploring potential modifications is dismissive and lacks cultural humility. This can create a barrier to communication and trust. It fails to recognize that many traditional foods can be adapted to fit a healthy eating pattern with appropriate portion control and preparation methods. Ethically, this approach is disrespectful and can perpetuate health disparities by implicitly devaluing certain cultural practices. A professional decision-making process for similar situations should begin with active listening and a thorough assessment of the patient's individual needs, preferences, and cultural background. The CD says should then use their knowledge of macronutrient roles in diabetes management to collaboratively develop a personalized plan that integrates these factors. This involves exploring modifications to traditional meals, suggesting alternative preparation methods, and educating the patient on how to balance their intake to achieve glycemic targets. The focus should always be on empowering the patient to make informed choices that support their health and well-being within their own cultural framework. Question 2. The review process indicates a need to evaluate how certified diabetes care and education specialists, CD says, conceptualize the application of glycemic index, GI, and glycemic load, GL, in patient education. Which of the following approaches best reflects a comprehensive and practical understanding of these concepts for effective diabetes self-management support? Option A, emphasizing that GI is the primary determinant of blood glucose response, and therefore, focusing solely on low GI foods is the most effective strategy for all individuals with diabetes. Option B, dismissing both GI and GL as overly complex and not directly relevant to the core principles of diabetes management, instead advocating for a general low-carbohydrate diet without specific food categorization. Option C, explaining that GL is a more practical measure than GI because it accounts for both the quality and quantity of carbohydrate in a typical serving, making it the sole focus for dietary recommendations. Option D, integrating both GI and GL into patient education, explaining that GI reflects the speed of glucose release from a carbohydrate source, and GL considers both the speed and the amount of carbohydrate consumed, enabling more personalized and effective dietary planning. The correct answer is A, emphasizing that GI is the primary determinant of blood glucose response, and therefore, focusing solely on low GI foods is the most effective strategy for all individuals with diabetes. Explanation: the review process indicates a need to assess the understanding of glycemic index, GI, and glycemic load, GL, concepts among certified diabetes care and education specialists, CD says. This scenario is professionally challenging because, while GI and GL are valuable tools, their application requires nuanced understanding beyond simple memorization of food values. Misapplication can lead to ineffective or even detrimental dietary advice, impacting patient outcomes and adherence to evidence-based practice guidelines. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of how both GI and GL contribute to blood glucose management. It acknowledges that GI provides information about the asterisk quality asterisk of carbohydrate, while GL considers both the asterisk quality asterisk and asterisk quantity asterisk. This integrated understanding allows for more personalized and practical dietary recommendations, aligning with the CDSA's scope of practice, which emphasizes individualized patient education and support for self-management. Adherence to evidence-based guidelines, such as those from the American Diabetes Association (ADA), which advocate for a balanced dietary approach that considers carbohydrate quality and quantity, is implicitly supported by this understanding. An incorrect approach that focuses solely on GI fails to account for the portion size of the carbohydrate, which is a critical determinant of the overall impact on blood glucose. This is a regulatory and ethical failure, as it provides incomplete information, potentially leading to poor dietary choices and suboptimal glycemic control. Deviates from best practices by oversimplifying a complex nutritional concept. Another incorrect approach that prioritizes GL without considering the GI can lead to recommending foods that, while having a lower GL due to small portion sizes, might still be of lower nutritional quality or contribute to other dietary imbalances. This is a failure to provide holistic nutritional guidance, potentially contravening ethical obligations to promote overall health and well-being. A further incorrect approach that dismisses both GI and GL entirely as irrelevant to diabetes management is a significant regulatory and ethical failure. It demonstrates a lack of knowledge of established nutritional science and evidence-based strategies for diabetes management, thereby failing to meet the professional standards expected of a CDSAS. This approach neglects a valuable educational tool that can empower individuals with diabetes to make informed food choices. The professional reasoning process for similar situations should involve 1. Identifying the core concept being assessed, GI/GL. 2. evaluating each option against established scientific principles and professional guidelines for diabetes education. 3. Considering the practical implications of each approach for patient self-management and glycemic control. 4. Recognizing that effective diabetes education requires a nuanced understanding of nutritional concepts, not just superficial knowledge. Question 3. Which approach would be most appropriate for a certified diabetes care and education specialist, CD says, to recommend when a patient with type 1 diabetes on a reduced carbohydrate intake reports feeling fatigued and shaky, with a slight increase in blood glucose readings, suggesting their body might be releasing glucagon and other counterregulatory hormones in response to the perceived low carbohydrate state. Option A. Advise the patient to immediately increase their carbohydrate intake to alleviate the symptoms and normalize blood glucose. Option B. Suggest adjusting insulin dosages based on the slight increase in blood glucose without further investigation into the hormonal response. Option C. Recommend a detailed assessment of the patient's counterregulatory hormone response and its impact on glucose levels, considering the potential for glucagon, epinephrine, and cortisol release to inform personalized management strategies. Option D. Dismiss the patient's symptoms as unrelated to hormonal fluctuations and focus solely on the observed blood glucose trend. The correct answer is C. Recommend a detailed assessment of the patient's counterregulatory hormone response and its impact on glucose levels, considering the potential for glucagon, epinephrine, and cortisol release to inform personalized management strategies. Explanation. This scenario is professionally challenging because it requires a certified diabetes care and education specialist, CD says, to interpret complex physiological responses to a specific dietary intervention in a patient with type 1 diabetes, considering the interplay of hormones beyond insulin. The CD says must move beyond basic glucose-lowering strategies to address the nuanced role of counterregulatory hormones, which can significantly impact glycemic control, especially during periods of reduced carbohydrate intake or exercise. The patient's reported symptoms of fatigue and shakiness, coupled with a slight increase in blood glucose, suggest a potential imbalance in these hormonal responses, necessitating a thorough understanding of glucagon's action and its interaction with other hormones like cortisol and epinephrine. The correct approach represents best professional practice because it directly addresses the patient's reported symptoms by considering the physiological mechanisms at play. By hypothesizing that the patient's body is releasing glucagon and other counterregulatory hormones in response to the perceived low carbohydrate state, the CD says is demonstrating a sophisticated understanding of diabetes pathophysiology. This understanding allows for a targeted assessment of the patient's hormonal response and its impact on glucose levels, which is crucial for personalized diabetes management. This aligns with the CD says scope of practice, which includes educating patients on the physiological factors influencing their diabetes management and developing strategies to optimize glycemic control. The focus on understanding the body's hormonal defense against hypoglycemia, even when overt hypoglycemia isn't present, is a key component of preventing future glycemic excursions and improving overall well-being. An incorrect approach that focuses solely on adjusting insulin without considering the hormonal response fails to address the root cause of the patient's symptoms. This could lead to inappropriate insulin adjustments, potentially exacerbating glycemic fluctuations or masking the underlying issue. It represents a failure to apply a comprehensive understanding of diabetes physiology and could be considered a deviation from best practice by not fully investigating the patient's reported experience. Another incorrect approach that dismisses the patient's symptoms as unrelated to hormonal responses overlooks critical subjective data. This approach neglects the possibility that the patient's body is actively compensating for perceived energy deficits through counterregulatory hormone release, which can manifest as subtle changes in glucose and perceived well-being. Ignoring these signals could lead to a missed opportunity for optimizing management and ensuring patient safety. A further incorrect approach that suggests increasing carbohydrate intake without a thorough assessment of the hormonal interplay is also problematic. While increasing carbohydrates might temporarily raise blood glucose, it doesn't address the underlying hormonal dysregulation that may be contributing to the symptoms. This could lead to a cycle of carbohydrate intake and subsequent hormonal responses, hindering long-term glycemic stability and patient education. The professional reasoning process for similar situations should involve a systematic evaluation of the patient's reported symptoms, their current diabetes management plan, and their physiological responses. This includes actively listening to the patient, considering the role of all relevant hormones, not just insulin, and formulating hypotheses based on established physiological principles. The CDSAS should then use this understanding to guide further assessment, education, and potential adjustments to the management plan, always prioritizing patient safety and evidence-based practice within the scope of their certification. Question 4. The risk matrix shows a moderate likelihood of a patient misunderstanding carbohydrate counting principles, potentially leading to suboptimal glycemic control. As a certified diabetes care and education specialist, you are educating a patient on managing their diabetes through diet. The patient expresses a desire for a specific meal plan to follow. Considering the regulatory framework for diabetes education in the United States, which approach best aligns with your scope of practice and ensures effective, compliant patient care. Option A. Focus solely on general healthy eating advice, such as choosing whole grains and lean proteins, without delving into specific carbohydrate counting methods or providing a meal plan. Option B. Directly prescribe a detailed, individualized meal plan with specific food items and portion sizes for each meal and snack, based on the patient's reported preferences and activity level. Option C. Provide the patient with a pre-written, generic 7-day meal plan that includes specific foods and portion sizes for every meal and snack, without further individualization. Option D. Teach the patient how to read food labels, identify carbohydrate-containing foods, and estimate portion sizes, empowering them to make their own informed food choices within their daily carbohydrate goals. Correct answer is D. Teach the patient how to read food labels, identify carbohydrate-containing foods, and estimate portion sizes, empowering them to make their own informed food choices within their daily carbohydrate goals. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified diabetes care and education specialist, CDSAS, by requiring them to navigate the complexities of carbohydrate counting and meal planning within the strict confines of U.S. regulatory frameworks governing diabetes education. The core challenge lies in ensuring that the educational approach aligns with established best practices and legal requirements, particularly concerning the provision of individualized medical nutrition therapy, MNT, advice. The CDSAS must balance the need for effective patient education with the legal and ethical boundaries of their practice, ensuring they do not overstep into prescribing specific dietary regimens without proper medical oversight or without adhering to the scope of practice as defined by relevant U.S. health regulations. Careful judgment is required to differentiate between general education on carbohydrate counting principles and the provision of a personalized meal plan, which may necessitate a referral or collaboration with a registered dietitian nutritionist, RDN. Correct approach analysis. The correct approach emphasizes empowering the patient with knowledge and skills to make informed food choices by teaching them the principles of carbohydrate counting and how to interpret food labels. This aligns with the CDSAS scope of practice, which includes providing education on nutrition and lifestyle modifications to manage diabetes. By focusing on teaching the patient how to count carbohydrates themselves and understand portion sizes, the CDSAS is facilitating self-management and promoting autonomy. This approach is consistent with U.S. guidelines for diabetes self-management education and support DSMES, which advocate for patient-centered education that builds skills and confidence. It also respects the boundaries of MNT, as the CDSAS is educating on a principle rather than dictating a specific meal plan, thereby avoiding potential regulatory issues related to practicing dietetics without licensure if not appropriately qualified or supervised. Incorrect approaches analysis. One incorrect approach involves directly providing a detailed, individualized meal plan with specific food items and portion sizes for each meal and snack. This could be construed as practicing medical nutrition therapy, MNT, without the necessary credentials or referral, potentially violating state licensure laws for dietitians and nutritionists in many U.S. jurisdictions. The CDSAS scope of practice typically focuses on education and support, not the direct prescription of therapeutic diets, unless they are also a licensed RDN. Another incorrect approach is to solely focus on general healthy eating advice without specifically addressing carbohydrate counting, which fails to meet the patient's stated need and the core components of effective diabetes management education. This misses a critical opportunity to equip the patient with a key tool for blood glucose control. A third incorrect approach might be to provide a generic, one-size-fits-all meal plan that does not account for the individual's preferences, cultural background, or other health conditions, which is not only ineffective but also ethically questionable as it fails to provide truly personalized and appropriate education. Professional reasoning. Professionals should adopt a decision-making framework that prioritizes patient autonomy and adherence to regulatory guidelines. When faced with a request for a meal plan, the CDSAs should first assess their own qualifications and the specific state regulations regarding MNT. If they are not a licensed RDN, the best practice is to educate the patient on the principles of carbohydrate counting and empower them to use this knowledge. If a personalized meal plan is deemed necessary and within the CDSA's scope, e.g., if they are also an RDN, it must be developed collaboratively with the patient, considering their individual needs and preferences and documented thoroughly. If the CDSAs is not qualified to provide a meal plan, they should refer the patient to a qualified RDN. This approach ensures that patient care is safe, effective, and compliant with all applicable U.S. health regulations and ethical standards for diabetes education. Question 5. The evaluation methodology shows that a patient expresses a strong interest in adopting a vegetarian diet to manage their type 2 diabetes. The CDSAs needs to determine the most appropriate initial response to support the patient's goals while ensuring effective diabetes care. Which of the following approaches best reflects current best practices and regulatory expectations for CDSAs? Option A. Assess the patient's current understanding of vegetarian diets and their potential impact on blood glucose, then collaboratively develop a plan to ensure nutritional adequacy and glycemic control within a vegetarian framework. Option B. Immediately advise the patient that while vegetarian diets can be healthy, they are often difficult to manage for diabetes and suggest they stick to a more traditional balanced diet. Option C. Provide the patient with a generic vegetarian meal plan from a reputable source without further discussion of their individual needs or understanding. Option D. Focus solely on the macronutrient breakdown of a vegetarian diet, emphasizing carbohydrate counting, without exploring the patient's motivations or potential nutrient deficiencies. The correct answer is A. Assess the patient's current understanding of vegetarian diets and their potential impact on blood glucose, then collaboratively develop a plan to ensure nutritional adequacy and glycemic control within a vegetarian framework. Explanation. The evaluation methodology shows that a certified diabetes care and education specialist, CDSAs, must navigate complex dietary recommendations while respecting individual patient choices and cultural backgrounds. This scenario is professionally challenging because it requires the CDSAs to balance evidence-based guidelines for diabetes management with the patient's personal preferences and potential misconceptions about specific diets. Careful judgment is required to ensure that dietary advice is not only effective for glycemic control, but also sustainable and culturally sensitive, avoiding the imposition of a one-size-fits-all approach. The correct approach represents best professional practice because it prioritizes a collaborative and individualized strategy. By first assessing the patient's current understanding and motivations regarding a vegetarian diet, the CDSAs can identify potential barriers and facilitators to adherence. This aligns with the ethical principle of patient autonomy and the regulatory framework that emphasizes person-centered care. The CDSAs then uses this information to provide tailored education on nutrient adequacy, e.g., B12, iron, omega-3s within a vegetarian context, ensuring the diet supports diabetes management without compromising nutritional status. This approach is consistent with the scope of practice for CDSAs, which includes providing education on various dietary patterns and their implications for diabetes. An incorrect approach that focuses solely on the perceived health benefits of a vegetarian diet without assessing the patient's readiness or understanding fails to acknowledge the patient's individual needs and preferences. This can lead to non-adherence and frustration, undermining the therapeutic relationship. Ethically, it disregards patient autonomy. From a regulatory perspective, it may violate guidelines that mandate individualized care plans. Another incorrect approach that dismisses the patient's interest in a vegetarian diet outright, without exploring its potential benefits or challenges in the context of diabetes, is also professionally unacceptable. This demonstrates a lack of cultural competence and can alienate the patient, hindering their engagement in diabetes self-management. It fails to meet the standard of care that requires exploring all viable dietary options that can be safely and effectively integrated into a diabetes management plan. A professional reasoning framework for similar situations involves a systematic process. 1. Patient assessment. Thoroughly understand the patient's current dietary habits, beliefs, motivations, cultural background, and readiness for change. 2. Information gathering. Elicit the patient's specific interest in a particular dietary pattern, e.g., vegetarian, Mediterranean, low-carb, and their understanding of it. 3. Evidence-based education. Provide accurate, evidence-based information about the chosen dietary pattern, including its potential benefits, risks, and specific considerations for diabetes management, e.g., nutrient deficiencies, glycemic impact. 4. Individualized planning. Collaboratively develop a personalized meal plan that incorporates the patient's preferences while meeting their nutritional needs and diabetes management goals. 5. Ongoing support. Offer continuous support, monitoring, and adjustments to the plan as needed, reinforcing the patient's self-efficacy. Question 6. The investigation demonstrates that a patient with a strong family history of type 2 diabetes also lives in an environment with limited access to fresh produce and frequent exposure to air pollution. Which of the following approaches best guides the diabetes care and education specialist in addressing this patient's risk? Option A. Acknowledge the genetic predisposition, but prioritize education on modifiable environmental factors, such as dietary choices and strategies to mitigate exposure to air pollutants, to reduce the patient's overall risk. Option B. Advise the patient that their genetic background makes lifestyle modifications largely ineffective, and that the primary focus should be on managing diabetes once it develops. Option C. Emphasize the significant role of genetic predisposition in the patient's diabetes risk and focus education on the inevitability of developing the condition given their family history. Option D. Downplay the genetic component of diabetes risk and solely focus on the patient's immediate environment, suggesting that genetics plays a negligible role in the development of type 2 diabetes. The correct answer is C. Emphasize the significant role of genetic predisposition in the patient's diabetes risk and focus education on the inevitability of developing the condition given their family history. Explanation. The investigation demonstrates a complex interplay of genetic predispositions and environmental exposures that contribute to the development of diabetes. This scenario is professionally challenging because diabetes care and education specialists must navigate the nuanced reality that while genetics may confer a higher risk, environmental factors are often modifiable and play a significant role in disease onset and progression. Effective education requires acknowledging both aspects without overemphasizing determinism or dismissing the impact of lifestyle and social determinants. The correct approach represents best professional practice because it integrates a comprehensive understanding of both genetic susceptibility and environmental influences. This aligns with the principles of holistic diabetes care, emphasizing personalized education that empowers individuals to understand their unique risk profile and make informed decisions about lifestyle modifications. By focusing on actionable environmental factors, the specialist provides practical guidance that can mitigate genetic predispositions, promoting self-management and potentially delaying or preventing disease. This approach is ethically sound as it respects patient autonomy and promotes well-being through evidence-based education. An incorrect approach that solely focuses on genetic predisposition without addressing environmental factors is professionally unacceptable. This failure to acknowledge modifiable risk factors can lead to a sense of fatalism in the individual, diminishing their motivation to engage in lifestyle changes. Ethically, it fails to provide comprehensive and actionable education, potentially leading to suboptimal health outcomes. Another incorrect approach that dismisses genetic factors entirely and solely blames environmental influences is also professionally unacceptable. This oversimplification ignores the biological reality of genetic susceptibility, which can be a source of anxiety and concern for individuals with a family history of diabetes. It may also lead to a lack of personalized risk assessment, failing to identify individuals who may require more intensive screening or preventative strategies due to their genetic makeup. Ethically, this approach can be perceived as judgmental and may alienate individuals who are seeking understanding and support. The professional decision-making process for similar situations should involve a thorough assessment of the individual's family history, lifestyle, socioeconomic factors, and environmental exposures. The specialist should then synthesize this information to provide tailored education that addresses both genetic and environmental contributors to diabetes risk. The focus should always be on empowering the individual with knowledge and skills to make positive changes, fostering a collaborative approach to diabetes prevention and management. This involves active listening, empathy, and a commitment to providing evidence-based, culturally sensitive education. Question 7. Cost-benefit analysis shows that targeted micronutrient supplementation can offer significant advantages in managing specific diabetes-related complications, yet patient adherence and access remain key challenges. A CDSAS is reviewing their practice guidelines for micronutrient considerations in adults with type 2 diabetes. Which of the following approaches best aligns with current evidence-based practice and ethical responsibilities? Option A. Recommending specific micronutrient supplements only after a thorough individual assessment of dietary intake, potential deficiencies, and discussion of evidence-based benefits and risks with the patient. Option B. Implementing a universal recommendation for all patients with type 2 diabetes to take a broad-spectrum multivitamin to ensure adequate micronutrient intake. Option C. Prioritizing the recommendation of the least expensive micronutrient supplement available to maximize cost savings for patients, regardless of specific formulation or bioavailability. Option D. Dismissing all micronutrient supplementation as unnecessary for diabetes management, focusing solely on diet and conventional pharmacotherapy. The correct answer is A. Recommending specific micronutrient supplements only after a thorough individual assessment of dietary intake, potential deficiencies, and discussion of evidence-based benefits and risks with the patient. Explanation. This scenario is professionally challenging because it requires a certified diabetes care and education specialist, CDSAS, to balance evidence-based micronutrient recommendations with the practical realities of patient access and affordability, all within the scope of their practice and ethical obligations. The CDSAS must consider the potential benefits of micronutrient supplementation for improved glycemic control and reduced complication risk against the costs and potential for adverse effects or interactions. The correct approach represents best professional practice because it prioritizes individualized patient care and evidence-based decision-making. A CDSAS is ethically and professionally obligated to assess each patient's unique needs, including their dietary intake, existing micronutrient status, if known or suspected, and potential for deficiency. Recommending supplementation based on a comprehensive assessment, considering the latest guidelines from reputable organizations such as the American Diabetes Association, ADA, or equivalent national bodies relevant to the CDSAS certification jurisdiction, and discussing potential benefits, risks, and alternatives with the patient aligns with the core principles of patient-centered care and professional responsibility. This approach ensures that interventions are safe, effective, and tailored to the individual, promoting optimal health outcomes and adherence. An incorrect approach that focuses solely on a broad, blanket recommendation for all patients with diabetes to take a specific micronutrient supplement, without individual assessment, fails to adhere to the principle of individualized care. This could lead to unnecessary expense for patients, potential for adverse effects in those who do not require supplementation, and a missed opportunity to address other critical dietary or lifestyle factors. Ethically, it violates the duty to provide care that is appropriate and beneficial to the individual. Another incorrect approach that dismisses any consideration of micronutrient supplementation, even when evidence suggests potential benefit for specific populations or complications, is also professionally problematic. This could stem from a misunderstanding of current research or an overly conservative stance that deprives patients of potentially beneficial interventions. It fails to uphold the CDSA's responsibility to stay current with evidence-based practices and to advocate for patient well-being. A further incorrect approach that prioritizes the cheapest available micronutrient supplement without considering quality, bioavailability, or potential interactions with other medications or conditions overlooks crucial aspects of patient safety and efficacy. This approach prioritizes cost over patient well-being and could lead to ineffective treatment or harm. The professional reasoning process for similar situations should involve a systematic approach. 1. Patient assessment. Thoroughly evaluate the patient's medical history, current medications, dietary habits, lifestyle, and any reported symptoms or concerns related to micronutrient status. 2. Evidence review. Consult current, evidence-based guidelines and research regarding micronutrient supplementation in diabetes management, focusing on the specific micronutrient in question and its relevance to the patient's profile. 3. Risk-benefit analysis. Weigh the potential benefits of supplementation against the risks, costs, and potential for adverse effects or interactions for the individual patient. 4. Patient education and shared decision-making. Engage the patient in a discussion about the findings, potential interventions, and alternatives, ensuring they understand the rationale, benefits, risks, and costs, and involve them in the decision-making process. 5. Monitoring and follow-up. If supplementation is initiated, establish a plan for monitoring its effectiveness and for any necessary adjustments or discontinuation. Question 8. Performance analysis shows that a patient with type 2 diabetes presents with significant obesity and evidence of impaired glucose tolerance despite current medication. Which approach best reflects a CDC's understanding of the impact of obesity on insulin sensitivity to guide patient education and management? Option A. Providing a generic diabetes meal plan that does not account for the individual's specific metabolic response to macronutrients or the inflammatory state associated with their obesity. Option B. Focusing primarily on the genetic predisposition for insulin resistance, suggesting that lifestyle changes may have limited impact due to inherent biological factors. Option C. Educating the patient on the direct physiological mechanisms by which excess adipose tissue, particularly visceral fat, contributes to inflammation and impaired insulin signaling, and tailoring lifestyle recommendations to address these specific pathways. Option D. Recommending a strict calorie-restricted diet and increased exercise regimen, without detailing how these changes specifically counteract the metabolic dysregulation caused by obesity. The correct answer is C. Educating the patient on the direct physiological mechanisms by which excess adipose tissue, particularly visceral fat, contributes to inflammation and impaired insulin signaling, and tailoring lifestyle recommendations to address these specific pathways. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes care and education specialist, CDCs, to interpret complex physiological data related to obesity and insulin sensitivity within the context of patient care. The challenge lies in translating this understanding into actionable, individualized education and management strategies that are both effective and compliant with professional standards and ethical guidelines. Misinterpreting the impact of obesity on insulin sensitivity can lead to suboptimal patient outcomes, including ineffective treatment plans and potential health complications. Correct approach analysis. The correct approach involves a comprehensive assessment of the individual's metabolic profile, considering the multifactorial impact of obesity on insulin sensitivity. This includes recognizing that visceral adipose tissue, inflammation, and hormonal dysregulation associated with obesity directly impair insulin signaling pathways. Best professional practice dictates that a CDCs should leverage this understanding to tailor education on lifestyle modifications, such as dietary adjustments and physical activity, that specifically target these underlying mechanisms. This aligns with the ethical obligation to provide evidence-based, patient-centered care and adhere to the scope of practice for CDCs, which emphasizes education and support for self-management. Incorrect approach is analysis. One incorrect approach would be to solely focus on weight reduction as the primary intervention without deeply understanding its physiological impact on insulin sensitivity. This fails to address the nuanced mechanisms at play and may lead to a less effective or sustainable management plan. Ethically, this could be considered a failure to provide comprehensive education, as it oversimplifies a complex issue. Another incorrect approach would be to attribute the reduced insulin sensitivity solely to genetic predisposition, neglecting the significant modifiable factors related to obesity. This overlooks the CDC's role in empowering patients to make lifestyle changes and could lead to a sense of helplessness and reduced adherence to recommendations. This represents a failure to apply current scientific understanding and a deviation from best practices in patient education. A further incorrect approach would be to recommend a generic, one-size-fits-all dietary plan without considering the individual's specific metabolic responses to different macronutrients and the role of obesity-induced inflammation. This lacks personalization and may not effectively improve insulin sensitivity, potentially leading to patient frustration and poor outcomes. This is a failure to adhere to patient-centered care principles. Professional reasoning. Professionals should approach this situation by first conducting a thorough patient assessment that includes anthropometric measurements, metabolic markers, and a detailed lifestyle history. This assessment should inform an individualized education plan that explains the specific ways obesity affects their insulin sensitivity and how targeted interventions can mitigate these effects. The decision-making process should prioritize evidence-based strategies, patient engagement, and ongoing monitoring to adjust the plan as needed, always within the ethical framework of promoting patient well-being and autonomy. Question 9. The evaluation methodology shows a patient's laboratory results including a fasting glucose of 120 mg/dl, an A1C of 2%, and an oral glucose tolerance test OGT with a 2-hour post-load glucose of 195 mg/dl. Which of the following interpretations best reflects a comprehensive and clinically relevant approach to this patient's glycemic status? Option A. The fasting glucose is elevated, the A1C is in the prediabetic range, and the OGT result clearly indicates diabetes, necessitating immediate initiation of pharmacotherapy. Option B. The fasting glucose and A1C are within normal limits, and the OGT result is also normal, suggesting no glycemic abnormalities. Option C. The fasting glucose and A1C are within normal limits, indicating no immediate concern for diabetes, and the OGT result should be disregarded due to potential variability. Option D. The A1C indicates prediabetes, while the fasting glucose is normal, and the OGT result suggests impaired glucose tolerance, requiring further investigation into potential causes of glucose dysregulation. The correct answer is C. The fasting glucose and A1C are within normal limits, indicating no immediate concern for diabetes, and the OGT result should be disregarded due to potential variability. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes care and education. Interpreting laboratory results in the context of patients' overall clinical presentation and history. The professional challenge lies in moving beyond a simple numerical interpretation to a nuanced understanding of what the results signify for the individual's diabetes management and potential underlying factors. This requires integrating knowledge of diagnostic criteria with an understanding of patient-specific variables, such as adherence to testing protocols, potential confounding factors, and the patient's lived experience. Careful judgment is required to avoid misdiagnosis, inappropriate treatment adjustments, or unnecessary patient anxiety. Correct approach analysis. The correct approach involves a comprehensive interpretation that considers the fasting glucose, A1C, and OGT results in conjunction with the patient's clinical history, current medications, and adherence to pre-test instructions. For instance, a fasting glucose slightly above the diagnostic threshold might be considered in light of recent illness or stress, while an elevated A1C provides a longer-term view of glycemic control. An abnormal OGT, especially if the patient experienced symptoms during the test, offers further insight into glucose metabolism. This holistic approach aligns with the principles of patient-centered care and evidence-based practice, which are foundational to the Certified Diabetes Care and Education Specialist (CDC's) role. It emphasizes understanding the individual's unique situation to guide effective education and management strategies, adhering to the ethical obligation to provide competent and individualized care. Incorrect approaches analysis. Focusing solely on a single laboratory value without considering the others or the patient's context is a significant regulatory and ethical failure. For example, solely relying on a single fasting glucose reading might lead to an inaccurate diagnosis if the patient did not fast properly or if other factors influenced the result. This disregards the established diagnostic criteria that often require confirmation with multiple tests or a combination of tests. Similarly, interpreting an A1C in isolation, without considering the OCT or fasting glucose, might miss nuances in glycemic variability or the immediate impact of lifestyle interventions. This approach is ethically problematic as it can lead to misinformed clinical decisions, potentially harming the patient by delaying appropriate management or initiating unnecessary interventions. It also fails to meet the professional standard of care expected of a CDSAS, which mandates a thorough and individualized assessment. Professional reasoning. Professionals should adopt a systematic approach to interpreting laboratory results. This involves 1. Reviewing all available laboratory data, fasting glucose, A1C, OGD, and understanding their respective diagnostic criteria and limitations. 2. Correlating laboratory findings with the patient's reported symptoms, medical history, current medications, and lifestyle factors. 3. Considering potential confounding variables that might affect test accuracy, e.g., recent illness, stress, medication changes, improper test preparation. 4. Integrating this information to form a comprehensive clinical picture. 5. Using this integrated understanding to develop a personalized education and management plan, which may involve further testing, medication adjustments, or targeted lifestyle interventions. This process ensures that decisions are evidence-based, patient-centered, and ethically sound. Question 10. Compliance review shows that a certified diabetes care and education specialist, CDSAS, is developing an educational plan for a patient newly diagnosed with type 2 diabetes. The patient has a family history of cardiovascular disease and early signs of retinopathy. Which of the following approaches best addresses the long-term microvascular and macrovascular complications of diabetes in this patient? Option A. Deliver a detailed presentation on the genetic predispositions to diabetes complications, assuming the patient will research the management strategies independently. Option B. Focus primarily on managing blood glucose levels through diet and exercise, as this is the most critical factor in preventing all long-term diabetes complications. Option C. Provide a comprehensive overview of all potential diabetes complications, emphasizing the patient-specific risk factors for both microvascular retinopathy, nephropathy, neuropathy, and macrovascular, cardiovascular disease, stroke, peripheral artery disease issues, and collaboratively develop a personalized plan for monitoring and management. Option D. Provide a list of all available medications that can help prevent specific complications, without discussing lifestyle modifications or the patient's current understanding. The correct answer is C. Provide a comprehensive overview of all potential diabetes complications, emphasizing the patient's specific risk factors for both microvascular retinopathy, nephropathy, neuropathy, and macrovascular, cardiovascular disease, stroke, peripheral artery disease issues, and collaboratively develop a personalized plan for monitoring and management. Explanation. Scenario analysis. This scenario presents a common challenge in diabetes care education, ensuring that individuals understand the long-term implications of their condition beyond immediate blood glucose management. The professional challenge lies in translating complex physiological processes, microvascular and macrovascular damage, into actionable knowledge and behavioral changes for a diverse patient population. Effective education requires tailoring information to individual literacy levels, cultural backgrounds, and personal risk factors, while also adhering to established clinical guidelines and best practices for diabetes management. The risk of patient non-adherence or misunderstanding can lead to accelerated disease progression and poorer health outcomes, highlighting the critical need for accurate and impactful education. Correct approach analysis. The correct approach emphasizes a comprehensive, individualized, and evidence-based strategy. It involves assessing the patient's current understanding, identifying specific risk factors for both microvascular retinopathy, nephropathy, neuropathy, and macrovascular, cardiovascular disease, stroke, peripheral artery disease complications, and collaboratively developing a personalized education plan. This plan should integrate lifestyle modifications, medication adherence, and regular screening for complications, all aligned with current clinical practice guidelines for diabetes care. This approach is best professional practice because it directly addresses the patient's unique needs and empowers them to actively participate in their care, thereby improving adherence and long-term outcomes. It aligns with the ethical principles of beneficence and autonomy, ensuring the patient receives the best possible care and has the information to make informed decisions. Regulatory frameworks for diabetes education typically mandate patient-centered, evidence-based approaches that promote self-management and prevent complications. Incorrect approaches analysis. One incorrect approach might involve providing generic, one-size-fits-all information about diabetes complications without assessing the patient's individual risk factors or understanding. This fails to meet the patient's specific needs and can lead to information overload or a lack of perceived relevance, hindering engagement and adherence. Ethically, this approach may violate the principle of non-maleficence by not adequately preparing the patient for potential risks, and it falls short of the professional standard of care expected in diabetes education. Another incorrect approach could be focusing solely on macrovascular complications while neglecting the equally important microvascular ones, or vice versa. This creates an incomplete picture of the disease's potential impact and leaves the patient vulnerable to preventable damage in neglected areas. This is a failure to provide comprehensive care and can be seen as a breach of professional duty, as it does not equip the patient with the full scope of knowledge necessary for effective self-management and complication prevention. A third incorrect approach might be to present information in a highly technical or jargon-filled manner, assuming a level of medical literacy that the patient does not possess. This can lead to confusion, frustration, and a sense of disempowerment, making it difficult for the patient to understand and act upon the information. This approach is not only ineffective, but can also be ethically problematic, as it fails to ensure that the patient truly comprehends the information being conveyed, thus impeding their ability to make informed decisions about their health. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including their current knowledge, beliefs, and perceived barriers to care. This is followed by the identification of specific educational needs related to both microvascular and macrovascular complications, tailored to the patient's individual risk profile. The next step involves collaboratively setting realistic, achievable goals and developing a personalized education plan that utilizes clear, accessible language and appropriate educational materials. Ongoing reinforcement, evaluation of understanding, and adjustment of the plan based on patient progress are crucial. This iterative process ensures that education is effective, patient-centered, and aligned with best practices and regulatory requirements for diabetes care. Question 11. Strategic planning requires a comprehensive approach to managing potential risks associated with physical activity for individuals with diabetes. Considering the Certified Diabetes Care and Education Specialist, CD says, role in promoting safe and effective self-management, which of the following strategies best addresses the proactive management of hypoglycemia during exercise? Option A. Developing a personalized plan that includes pre-exercise glucose monitoring, carbohydrate intake adjustments based on anticipated activity intensity and duration, and clear guidelines for post-exercise monitoring and symptom recognition. Option B. Focusing solely on immediate treatment of hypoglycemia with fast-acting carbohydrates only after symptoms appear during exercise. Option C. Recommending that the individual cease all physical activity if their blood glucose is below a certain threshold, without considering the specific context of the exercise. Option D. Advising the individual to always consume a fixed amount of carbohydrates before any physical activity, regardless of the type or duration of exercise. The correct answer is A. Developing a personalized plan that includes pre-exercise glucose monitoring, carbohydrate intake adjustments based on anticipated activity intensity and duration, and clear guidelines for post-exercise monitoring and symptom recognition. Explanation. This scenario is professionally challenging because managing hypoglycemia during physical activity requires a proactive, individualized, and evidence-based approach that balances the benefits of exercise with the risks of low blood glucose. The Certified Diabetes Care and Education Specialist, CD says, must consider the individual's specific diabetes management plan, type of physical activity, intensity, duration, and personal response to exercise. Failure to adequately prepare can lead to serious adverse events, impacting the individual's safety, confidence, and long-term adherence to both diabetes management and physical activity. The correct approach represents best professional practice because it prioritizes the individual's safety and autonomy while empowering them with the knowledge and skills to manage their condition effectively during physical activity. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the individual's well-being and avoiding harm. Furthermore, it adheres to the core competencies of a CDSAS, which include providing education on self-management strategies, risk reduction, and the impact of lifestyle factors on diabetes control. This approach is grounded in current clinical guidelines and best practices for diabetes management, emphasizing personalized care and shared decision-making. An incorrect approach that focuses solely on immediate symptom management, without considering preventative strategies, fails to uphold the principle of non-maleficence by not adequately addressing the root cause and potential for recurrence. It also neglects the educational mandate of a CDSAS, leaving the individual ill-equipped for future similar situations. Another incorrect approach that relies on a one-size-fits-all recommendation, disregarding the individual's unique physiological response, diabetes type, and medication regimen, violates the principle of individualized care. This can lead to ineffective management, increased risk of hypoglycemia or hyperglycemia, and erosion of trust in the CDSAS. It also fails to meet the standards of care expected of a credentialed professional. A third incorrect approach that overemphasizes strict carbohydrate intake without considering the nuances of exercise intensity and duration, or the individual's ability to monitor their glucose levels, can lead to unnecessary dietary restrictions and potentially hinder participation in physical activity. This approach may not be sustainable or conducive to a healthy lifestyle, and it fails to empower the individual with adaptive strategies. The professional decision-making process for similar situations should involve a thorough assessment of the individual's current diabetes management plan, including medications, typical blood glucose patterns, and any history of exercise-induced hypoglycemia. This should be followed by a discussion about the planned physical activity, including its type, intensity, and duration. Based on this information, the CDSAS should collaboratively develop a personalized plan that includes strategies for glucose monitoring before, during, and after exercise, appropriate carbohydrate intake adjustments, and emergency preparedness. Education on recognizing and treating hypoglycemia, as well as strategies for preventing it, is paramount. Ongoing follow-up and adjustment of the plan based on the individual's experience are crucial for long-term success. Question 12. Implementation of a safe and effective exercise plan for a patient with type 1 diabetes who has a history of post-exercise hypoglycemia requires a CDSAS to assess the patient's readiness and potential risks. Which of the following approaches best guides the CDSAS in developing this plan? Option A. Recommend a significant reduction in basal insulin dose prior to any planned physical activity, regardless of the type or duration. Option B. Focus solely on immediate post-exercise blood glucose readings to ensure the patient is not experiencing hypoglycemia during the activity. Option C. Emphasize continuous glucose monitoring data and carbohydrate intake adjustments based on anticipated exercise intensity and duration, with a plan for post-exercise monitoring for up to 24 hours. Option D. Advise the patient to rely on their subjective feeling of well-being to determine if their blood glucose is stable enough for exercise. The correct answer is C. Emphasize continuous glucose monitoring data and carbohydrate intake adjustments based on anticipated exercise intensity and duration, with a plan for post-exercise monitoring for up to 24 hours. Explanation. The scenario presents a common challenge for certified diabetes care and education specialists, CDSAS, where a patient with type 1 diabetes is eager to increase their physical activity, but has a history of unpredictable hypoglycemia during and after exercise. The professional challenge lies in balancing the patient's desire for improved health and well-being with the critical need to prevent dangerous blood glucose fluctuations, particularly hypoglycemia, which can have immediate and long-term consequences. This requires a nuanced understanding of exercise physiology in the context of diabetes management, individual patient variability, and adherence to established best practices for safe and effective diabetes self-management education. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's current diabetes management, exercise history, and potential risks. It emphasizes proactive strategies for blood glucose monitoring before, during, and after exercise, tailored to the specific type, intensity, and duration of the planned activity. This aligns with the core principles of diabetes care and education, which mandate patient-centered, evidence-based interventions that promote safety and optimize health outcomes. Specifically, it adheres to guidelines that stress the importance of understanding how different types of exercise impact glucose levels and the need for individualized adjustments to insulin, carbohydrate intake, and monitoring frequency. This approach fosters patient empowerment and self-efficacy by equipping them with the knowledge and skills to manage their diabetes safely during physical activity. An incorrect approach that focuses solely on immediate post-exercise glucose readings fails to address the potential for delayed hypoglycemia, a significant risk for individuals with type 1 diabetes. This oversight represents a failure to provide comprehensive diabetes self-management education, potentially leading to dangerous glucose drops hours after the activity has ceased. Another incorrect approach that relies on the patient's subjective feeling of well-being to guide glucose management neglects the objective data from blood glucose monitoring, which is crucial for preventing hypoglycemia. This approach is ethically problematic as it prioritizes subjective experience over objective safety measures, potentially exposing the patient to undue risk. An approach that recommends a blanket reduction in insulin without considering the specific exercise type, duration, and intensity, or the patient's individual response, is also a regulatory and ethical failure. Such a generalized recommendation can lead to hyperglycemia or, conversely, severe hypoglycemia if the exercise is less intense or shorter than anticipated, demonstrating a lack of individualized care and adherence to evidence-based practice. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough assessment of the patient's current diabetes management, including medication regimen, typical blood glucose patterns, and any previous exercise-related complications. Second, engage in shared decision-making with the patient, understanding their goals and motivations for exercise. Third, educate the patient on the physiological impact of different types of exercise on blood glucose, emphasizing the importance of pre, during, and post-exercise monitoring. Fourth, collaboratively develop an individualized plan that includes specific strategies for carbohydrate intake, insulin adjustments, if applicable and within the CDC's scope of practice, and a clear monitoring schedule. Finally, establish a follow-up plan to review the effectiveness of the strategies and make necessary adjustments based on the patient's experience and blood glucose data. Question 13. Risk assessment procedures indicate a patient presence with persistent hyperglycemia, polyuria, and polydipsia. While these symptoms are common across different types of diabetes, further investigation into the underlying cellular mechanisms reveals a state of impaired insulin sensitivity in peripheral tissues and a gradual decline in pancreatic beta cell function, leading to a relative insufficiency of insulin to overcome resistance. Which pathophysiological mechanism best explains this patient's presentation? Option A. Autoimmune destruction of pancreatic beta cells leading to absolute insulin deficiency. Option B. Excessive gluconeogenesis due to impaired hepatic insulin signaling. Option C. Impaired insulin secretion and increased insulin resistance. Option D. Genetic mutations affecting insulin receptor function. The correct answer is A. Autoimmune destruction of pancreatic beta cells leading to absolute insulin deficiency. Explanation: this scenario presents a professional challenge because it requires a certified diabetes care and education specialist, CDC's, to differentiate between two distinct pathophysiological mechanisms of hyperglycemia, both of which can manifest with similar clinical signs. Accurate differentiation is crucial for tailoring effective self-management education and treatment plans, directly impacting patient outcomes and adherence to care standards. Misidentification can lead to inappropriate interventions, potentially exacerbating the condition or delaying effective management. The correct approach represents best professional practice by accurately identifying the underlying pathophysiology of insulin resistance and relative insulin deficiency, which is characteristic of type 2 diabetes. This aligns with the core competencies of a CDC's to provide evidence-based education tailored to specific disease states. The regulatory framework for CDSAS certification emphasizes a deep understanding of diabetes pathophysiology to ensure safe and effective patient care. By focusing on the mechanisms of impaired insulin secretion and action, the CDSAS can guide the patient towards appropriate lifestyle modifications, medication adherence, and monitoring strategies that address the root cause of hyperglycemia, thereby promoting optimal glycemic control and preventing long-term complications, as mandated by professional practice standards. An incorrect approach that focuses solely on absolute insulin deficiency without considering the role of insulin resistance fails to acknowledge the complex interplay of factors in type 2 diabetes. This represents a significant regulatory and ethical failure, as it deviates from the established understanding of type 2 diabetes pathophysiology and can lead to misdiagnosis or suboptimal treatment. Ethically, it breaches the duty of care by providing incomplete or inaccurate information. Another incorrect approach that attributes hyperglycemia solely to excessive carbohydrate intake, without investigating the underlying cellular mechanisms of insulin resistance or impaired insulin secretion, is also a regulatory and ethical failure. While diet is a critical component of diabetes management, it is a modifiable factor influenced by the body's ability to utilize glucose, which is dictated by pathophysiology. Failing to address the pathophysiology means the education provided is superficial and unlikely to lead to sustained improvement. The professional decision-making process for similar situations should involve a systematic assessment of the patient's clinical presentation, medical history, and laboratory data. The CDSAS should then apply their knowledge of diabetes pathophysiology to formulate a differential diagnosis. This involves considering the hallmarks of type 1 diabetes, autoimmune destruction of beta cells leading to absolute insulin deficiency, versus type 2 diabetes insulin resistance coupled with progressive Bayer cell dysfunction. Based on this differential, the CDSAS should then select educational strategies and interventions that are specifically targeted to the identified pathophysiological mechanism, ensuring that the patient receives the most appropriate and effective care. This iterative process of assessment, diagnosis, and targeted intervention is fundamental to ethical and competent diabetes care. Question 14. Investigation of a patient newly prescribed a GLP-1 receptor agonist for type 2 diabetes, who also has a history of pancreatitis and is currently taking an ACE inhibitor for hypertension, reveals a potential for gastrointestinal side effects. What is the most critical next step for the diabetes care and education specialist to ensure patient safety? Option A. Review the prescribing information for the GLP-1 receptor agonist specifically for contraindications related to a history of pancreatitis and potential interactions with ACE inhibitors, and then educate the patient on these specific risks and what symptoms warrant immediate medical attention. Option B. Advise the patient to discontinue the ACE inhibitor immediately due to potential additive gastrointestinal effects with the new diabetes medication. Option C. Assume the prescribing physician has already considered the patient's history of pancreatitis and the ACE inhibitor, and therefore focus solely on educating the patient about the benefits of the new medication. Option D. Provide the patient with a general handout on common gastrointestinal side effects of GLP-1 receptor agonists and advise them to report any discomfort to their primary care physician. The correct answer is A. Review the prescribing information for the GLP-1 receptor agonist specifically for contraindications related to a history of pancreatitis and potential interactions with ACE inhibitors, and then educate the patient on these specific risks and what symptoms warrant immediate medical attention. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the diabetes care and education specialist to synthesize information about a patient's new medication, their existing health conditions, and potential drug interactions. The specialist must not only identify potential side effects, but also understand which ones are contraindications, meaning they are absolute reasons not to use the medication. This demands a deep understanding of pharmacology specific to diabetes management and a thorough patient assessment. The specialist must also consider the patient's ability to understand and report side effects, adding a layer of communication and education complexity. Correct approach analysis. The correct approach involves a comprehensive review of the patient's medical history, current medications, and the newly prescribed medications prescribing information. This includes specifically looking for documented contraindications and common or serious side effects that might be exacerbated by the patient's existing conditions. The specialist then needs to educate the patient about these potential issues, emphasizing what to watch for and when to seek immediate medical attention. This aligns with the Certified Diabetes Care and Education Specialist (CD) says scope of practice and standards of professional practice, which mandate providing evidence-based education and ensuring patient safety. The CD says is expected to advocate for the patient and collaborate with the healthcare team to optimize care, which includes proactively addressing potential medication-related harm. This approach prioritizes patient well-being and adherence to safe medication practices as outlined by professional guidelines. Incorrect approaches analysis. One incorrect approach involves solely focusing on the most common side effects without investigating contraindications. This fails to meet the professional obligation to identify absolute risks that could lead to severe harm or death. Regulatory frameworks and ethical guidelines for healthcare professionals emphasize the importance of identifying and mitigating life-threatening risks, not just common discomforts. This approach could lead to a patient experiencing a severe adverse event that could have been prevented. Another incorrect approach is to assume the prescribing physician has already accounted for all potential issues, and therefore not to conduct an independent review of the medication's contraindications and side effects in relation to the patient's specific profile. This abdication of responsibility is a significant ethical and professional failure. CD says professionals are expected to be knowledgeable and to apply that knowledge to ensure patient safety, acting as a critical point of review within the healthcare team. Relying solely on the prescriber without independent verification can lead to errors of omission and patient harm, violating professional standards of care and potentially regulatory requirements for patient safety oversight. A third incorrect approach is to provide generic information about side effects without tailoring it to the patient's specific health conditions and other medications. This lacks the depth of analysis required for safe and effective diabetes education. Contraindications and significant side effects are often context-dependent. Failing to personalize this information means the patient may not understand which potential side effects are particularly relevant or dangerous for them, undermining the educational goal and compromising patient safety. This is a failure to provide individualized care, a cornerstone of professional practice in healthcare. Professional reasoning. When faced with a new medication for a patient with diabetes, a professional decision-making process should involve 1. Thoroughly reviewing the patient's complete medical history, including all comorbidities and current medications. 2. Consulting the official prescribing information for the new medication, paying close attention to contraindications, warnings, precautions, and potential drug-drug interactions. 3. Cross-referencing potential side effects with the patient's existing conditions to identify any synergistic risks or contraindications. 4. Developing a clear, individualized education plan for the patient, focusing on the most critical side effects and contraindications relevant to their specific situation, and outlining clear steps for reporting concerns. 5. Documenting the assessment, education provided, and any follow-up plans. This systematic approach ensures patient safety and adherence to professional and regulatory standards. Question 15. The control framework reveals a patient presenting with hyperglycemia, a family history suggestive of diabetes, and a recent diagnosis of pancreatitis. The patient is an adult with no prior history of diabetes. The diabetes care and education specialist is tasked with determining the most appropriate classification of the patient's diabetes to guide educational interventions. Considering the potential for LADA, MODI, or secondary diabetes, which of the following diagnostic considerations is most critical for accurate classification and subsequent patient education? Option A. Prioritizing a family history of type 2 diabetes and educating the patient on lifestyle modifications typically used for type 2 diabetes management. Option B. Evaluating for the presence of autoantibodies and assessing the rate of beta cell decline, alongside investigating potential genetic mutations characteristic of MODI and ruling out other endocrine or exocrine disorders that could cause secondary diabetes. Option C. Assuming the diagnosis is LADA due to the adult onset and proceeding with insulin therapy education without further investigation. Option D. Focusing solely on the pancreatitis diagnosis as the cause of diabetes and educating the patient on managing diabetes secondary to pancreatic disease. The correct answer is B. Evaluating for the presence of autoantibodies and assessing the rate of beta cell decline, alongside investigating potential genetic mutations characteristic of MODY and ruling out other endocrine or exocrine disorders that could cause secondary diabetes. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a diabetes care and education specialist to navigate the complexities of classifying a patient's diabetes subtype, which has significant implications for treatment, management, and long-term prognosis. Misclassification can lead to suboptimal care, patient frustration, and potential health complications. The specialist must apply their knowledge of diagnostic criteria and clinical presentation to differentiate between LADA, MODY, and secondary diabetes, all while respecting patient autonomy and ensuring accurate documentation. Correct approach analysis. The correct approach involves a thorough assessment of the patient's clinical history, family history, and laboratory findings to accurately classify the diabetes subtype. This aligns with the professional standards of practice for certified diabetes care and education specialists, which emphasize evidence-based assessment and individualized care plans. Accurate classification ensures that the patient receives the most appropriate therapeutic interventions, educational support, and monitoring strategies, thereby optimizing health outcomes and adhering to ethical principles of beneficence and non-maleficence. This approach also supports accurate medical record keeping, which is a regulatory requirement. Incorrect approach is analysis. One incorrect approach would be to assume the diagnosis based solely on the patient's age of onset, without considering other diagnostic factors. This fails to adhere to the comprehensive diagnostic criteria for LADA, MODY, and secondary diabetes, potentially leading to misdiagnosis and inappropriate treatment. Ethically, this is a failure of due diligence and could result in harm to the patient. Another incorrect approach would be to rely on a single laboratory test result without integrating it with the patient's overall clinical picture. For instance, solely focusing on autoantibody status without considering genetic predisposition or the presence of other conditions that can cause secondary diabetes would be insufficient. This approach neglects the multifaceted nature of diabetes classification and violates the principle of holistic patient care. A third incorrect approach would be to defer the classification entirely to another healthcare provider without contributing the specialist's expertise. While collaboration is crucial, the diabetes care and education specialist has a specific role and knowledge base in this area. Failing to engage in the diagnostic process when it falls within their scope of practice is a dereliction of professional responsibility and could delay accurate diagnosis and management. Professional reasoning. Professionals should approach such situations by first gathering all relevant patient data, including medical history, family history, physical examination findings, and laboratory results. They should then systematically evaluate this information against the diagnostic criteria for various diabetes subtypes, such as LADA, autoimmune diabetes in adults, MODY, monogenic diabetes of youth, and secondary diabetes, caused by other conditions or medications. If there is uncertainty, consultation with an endocrinologist or other relevant specialists is appropriate, but the specialist should actively participate in the diagnostic process. The decision-making process should prioritize patient safety, accurate diagnosis, and evidence-based practice, ensuring that the patient receives the most effective and individualized care. Question 16. Risk assessment procedures indicate that Mr. Henderson, a 68-year-old male with type 2 diabetes, also has a history of stable congestive heart failure, CHF, and is currently taking an ACE inhibitor and a beta blocker. His HbA1c is 2%. Considering his comorbidities and current medications, which of the following medication classes, when initiating a new oral agent for glycemic control, would be most appropriate to consider due to its mechanism of action and potential cardiovascular benefits? Option A. A medication that inhibits the enzyme responsible for breaking down incretins, thereby increasing insulin release and decreasing glucagon levels. Option B. A medication that increases insulin sensitivity in peripheral tissues and the liver, with a mechanism that may lead to fluid retention. Option C. A medication that blocks the reabsorption of glucose in the renal tubules, leading to increased urinary glucose excretion. Option D, a medication that enhances insulin secretion and suppresses glucagon release, with a mechanism that also demonstrates cardiovascular benefits in patients with heart failure. The correct answer is D, a medication that enhances insulin secretion and suppresses glucagon release, with a mechanism that also demonstrates cardiovascular benefits in patients with heart failure. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the diabetes care and education specialist to synthesize information about a patient's specific comorbidities and current medication regimen to select an appropriate new pharmacologic agent. The challenge lies in understanding the nuanced mechanisms of action of various diabetes medications and how they interact with or are contraindicated by other conditions and drugs, ensuring patient safety and optimal therapeutic outcomes within the established regulatory framework for diabetes management. Correct approach analysis. The correct approach involves selecting a medication whose mechanism of action directly addresses the patient's primary glycemic control needs, while also offering benefits that mitigate or are neutral to their existing comorbidities. For instance, if a patient has heart failure, a medication class known to improve cardiovascular outcomes, such as an SGLT2 inhibitor or GLP-1 receptor agonist, would be a superior choice due to their established benefits in this population, aligning with current evidence-based guidelines and regulatory recommendations for comprehensive diabetes care. This approach prioritizes patient safety, efficacy, and the management of multiple health conditions simultaneously, adhering to the principles of patient-centered care and the scope of practice for a certified diabetes care and education specialist. Incorrect approach is analysis, an approach that selects a medication solely based on its potent glucose-lowering effect without considering the patient's heart failure would be professionally unacceptable. This failure constitutes a breach of professional responsibility by potentially exacerbating the patient's existing condition or introducing new cardiovascular risks, which is contrary to the ethical imperative of do no harm and the regulatory expectation for safe and effective medication management. Another incorrect approach would be to choose a medication with a mechanism of action that is known to be contraindicated or associated with significant adverse effects in patients with heart failure, such as certain sulfonylureas or thiazolidinediones, without a compelling clinical justification and thorough risk-benefit analysis. This demonstrates a lack of understanding of drug-drug and drug-disease interactions, leading to potentially dangerous patient outcomes and a failure to meet professional standards of care. Finally, selecting a medication without a clear understanding of its mechanism of action and how it might interact with the patient's current medications for heart failure would be a significant professional failure. This oversight could lead to unintended pharmacodynamic or pharmacokinetic interactions, compromising the efficacy of either medication or increasing the risk of adverse events, thereby failing to provide safe and effective diabetes education and management. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including a detailed medical history, review of current medications, and identification of comorbidities. This is followed by an evaluation of the patient's glycemic targets and individual preferences. The next step involves understanding the mechanisms of action of various diabetes medication classes and their potential benefits and risks, particularly in the context of the patient's specific health profile. Evidence-based guidelines and regulatory recommendations should then be consulted to inform the selection of the most appropriate pharmacologic agent. Finally, a collaborative discussion with the patient, involving shared decision-making, is crucial to ensure adherence and optimize outcomes. Question 17. Operational review demonstrates that a patient diagnosed with type 2 diabetes expresses significant reluctance to incorporate regular physical activity into their daily routine, citing a preference for a more sedentary lifestyle. As a certified diabetes care and education specialist, what is the most ethically and professionally sound approach to address this situation? Option A. Explore the patient's specific barriers and concerns regarding exercise. Provide tailored education on the benefits of physical activity for diabetes management, and collaboratively develop a realistic, achievable exercise plan that respects their preferences and limitations. Option B. Provide a generic pamphlet on the general health benefits of exercise and assume the patient will independently decide if and how to incorporate it. Option C. Insist on a structured, high-intensity exercise program, emphasizing that it is non-negotiable for effective diabetes control, and document the patient's refusal. Option D. Accept the patient's stated preference for a sedentary lifestyle without further discussion or education, as respecting patient autonomy is paramount. The correct answer is A. Explore the patient's specific barriers and concerns regarding exercise. Provide tailored education on the benefits of physical activity for diabetes management, and collaboratively develop a realistic, achievable exercise plan that respects their preferences and limitations. Explanation. Scenario analysis. This scenario presents a professional challenge where a certified diabetes care and education specialist, CD says, must balance patient autonomy with the imperative to provide evidence-based recommendations for optimal diabetes management. The patient's expressed preference for a less active lifestyle, despite a diagnosis of type 2 diabetes, creates a conflict between respecting individual choices and fulfilling the CDSA's ethical and professional duty to promote health and well-being through proven interventions like exercise. The challenge lies in navigating this delicate balance without being coercive or dismissive of the patient's concerns, while still ensuring they receive accurate information about the significant benefits of exercise. Correct approach analysis. The correct approach prioritizes patient-centered care and education. It involves a thorough exploration of the patient's reasons for reluctance towards exercise, addressing any barriers or misconceptions they may have. This approach aligns with the ethical principles of autonomy and beneficence, as it respects the patient's right to make informed decisions while actively working to provide them with the knowledge and support needed to achieve better health outcomes. By offering tailored, achievable exercise recommendations and emphasizing the positive impacts on blood glucose control, cardiovascular health, and overall quality of life, the CD says empowers the patient to make a more informed choice. This aligns with professional guidelines that advocate for collaborative goal setting and individualized care plans in diabetes education. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concerns and insisting on a rigorous exercise regimen. This fails to respect patient autonomy and can lead to disengagement and non-adherence. Ethically, it can be seen as paternalistic and may violate the principle of respect for persons. From a regulatory standpoint, it may not align with standards of care that emphasize shared decision-making and patient-centered education. Another incorrect approach is to simply accept the patient's refusal without further exploration or education. While respecting autonomy, this approach neglects the CDSA's professional responsibility to educate and advocate for evidence-based practices that can significantly improve health outcomes. This could be considered a failure of beneficence, as the patient is not being fully informed of the potential benefits of exercise for their condition. A third incorrect approach might involve providing generic, uninspired information about exercise without addressing the patient's specific situation or concerns. This lacks the individualized approach necessary for effective diabetes education and may not be persuasive enough to overcome the patient's reluctance. It fails to meet the professional standard of providing tailored, actionable advice. Professional reasoning. When faced with a patient reluctant to engage in exercise, a CD says should employ a motivational interviewing approach. This involves active listening, empathic reflection, and open-ended questions to understand the patient's perspective, values, and barriers. The professional should then provide clear, evidence-based information about the benefits of exercise specifically tailored to the patient's diabetes management goals, such as improved glycemic control, reduced risk of complications, and enhanced energy levels. The focus should be on collaboratively developing a realistic and achievable exercise plan that aligns with the patient's preferences and capabilities, emphasizing small, sustainable steps rather than overwhelming demands. This process ensures that the patient feels heard, respected, and empowered to make informed decisions about their health. Question 18. The analysis reveals that a 65-year-old patient with type 2 diabetes, currently managed with oral agents and experiencing progressive hyperglycemia, is being considered for insulin therapy. The patient expresses a strong desire for a regimen that involves the fewest possible injections per day, stating, "I just want something simple. I don't want to be bothered with too many shots." The patient has a history of mild cognitive impairment and lives alone. Considering the patient's age, cognitive status, living situation, and expressed preference, Which of the following approaches best aligns with the principles of safe and effective diabetes care and education within the regulatory framework for CDSES professionals? Option A. Prescribe a single daily injection of long-acting insulin, assuming this will be the simplest option and will likely achieve the patient's goal of minimal injections. Option B. Recommend an insulin pump, explaining its continuous glucose monitoring capabilities and the need for frequent adjustments and technical understanding. Option C. Discuss the pros and cons of a premixed insulin regimen, e.g., twice-daily injections combining rapid-acting and intermediate-acting insulin, and assess the patient's understanding of its timing, potential for hypoglycemia, and the need for consistent meal patterns before making a recommendation. Option D. Initiate a basal bolus regimen with rapid-acting insulin before meals and long-acting insulin once daily, providing detailed education on carbohydrate counting and injection technique. The correct answer is D. Initiate a basal bolus regimen with rapid-acting insulin before meals and long-acting insulin once daily, providing detailed education on carbohydrate counting and injection technique. Explanation. This scenario presents a common challenge in diabetes care and education, individualizing insulin therapy based on a patient's lifestyle, preferences, and understanding, while adhering to established best practices and regulatory guidelines for patient education. The professional challenge lies in balancing the patient's expressed desire for simplicity with the need to ensure safe and effective glycemic control, considering the distinct pharmacokinetic profiles of different insulin types. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's needs and readiness for self-management. This involves a thorough discussion of the implications of each insulin type, including potential risks and benefits, and collaboratively developing a plan that aligns with the patient's capacity for adherence and understanding. This aligns with the ethical principle of patient autonomy and the regulatory requirement to provide patient-centered education that promotes self-care and safety. Specifically, the Certified Diabetes Care and Education Specialist, CDSES, is expected to assess the patient's health literacy, cognitive function, and support system to ensure they can safely manage their prescribed insulin regimen. This includes understanding the timing of injections, potential for hypoglycemia, and the importance of consistent carbohydrate intake, especially with rapid-acting and premixed insulins. An incorrect approach that solely focuses on the patient's stated preference for fewer injections, without a thorough assessment of their understanding of the associated risks, is professionally unacceptable. This could lead to suboptimal glycemic control, increased risk of hypoglycemia or hyperglycemia, and potential patient harm. Ethically, it violates the duty of care by not adequately educating the patient about the implications of their choices. From a regulatory standpoint, it fails to meet the standard of care for diabetes education, which mandates comprehensive and individualized instruction. Another incorrect approach that involves prescribing a specific insulin type without engaging the patient in a discussion about their lifestyle and preferences disregards the patient-centered nature of diabetes education and care. This can lead to poor adherence and dissatisfaction, undermining the therapeutic goals. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough patient assessment, including medical history, current glycemic control, lifestyle, cultural factors, and health literacy. Second, educate the patient comprehensively about all available treatment options, including the benefits, risks, and practical considerations of each insulin type, rapid-acting, long-acting, premixed. Third, engage in shared decision-making, empowering the patient to participate actively in choosing a regimen that best suits their individual circumstances and goals. Finally, establish a clear follow-up plan to monitor the effectiveness of the chosen regimen, assess for adherence, and make necessary adjustments. Question 19. Strategic planning requires a certified diabetes care and education specialist to develop a comprehensive physical activity regimen for a client with type 2 diabetes who also experiences osteoarthritis, which approach best optimizes the client's health outcomes by integrating the benefits of different exercise modalities while respecting their joint condition. Option A. Advise on high-intensity interval training (HIIT) for aerobic benefits and heavy weightlifting for muscle strengthening, as these yield the most significant metabolic improvements. Option B. Implement a program that exclusively focuses on low-impact aerobic exercises, such as swimming and cycling, to minimize joint stress. Option C. Recommend primarily flexibility and stretching exercises to enhance joint mobility and reduce stiffness. As this is the primary concern, Option D. Design a personalized plan that incorporates a combination of low-impact aerobic activities, resistance training with modifications for joint protection, and flexibility exercises to improve range of motion. The correct answer is B. Implement a program that exclusively focuses on low-impact aerobic exercises, such as swimming and cycling, to minimize joint stress. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified diabetes care and education specialist, CD says, to tailor physical activity recommendations to an individual with type 2 diabetes who also has osteoarthritis. The CD says must balance the benefits of different types of physical activity for diabetes management with the limitations imposed by the joint condition, ensuring safety and efficacy. This necessitates a deep understanding of how aerobic, resistance, and flexibility exercises impact blood glucose control, cardiovascular health, and joint function, while also considering the individual's specific pain levels, range of motion, and potential for exacerbation of symptoms. Correct approach analysis. The correct approach is to integrate all three types of physical activity, aerobic, resistance, and flexibility, into a personalized plan, prioritizing low-impact options for aerobic and resistance training and emphasizing gentle stretching for flexibility. This aligns with best professional practice as outlined by the American Diabetes Association, ADA, standards of care, which recommend a comprehensive approach to physical activity for individuals with diabetes. Specifically, the ADA guidelines advocate for at least 150 minutes of moderate-intensity aerobic activity per week, supplemented by resistance training 2-3 times per week, and flexibility exercises as needed. For someone with osteoarthritis, low-impact aerobic activities like swimming, cycling, or walking are encouraged to minimize joint stress. Resistance training should focus on controlled movements and lighter weights or resistance bands to protect joints. Flexibility exercises, such as gentle yoga or static stretching, can improve range of motion and reduce stiffness without aggravating the osteoarthritis. This holistic approach maximizes the benefits for both diabetes management and joint health, adhering to ethical principles of beneficence and non-maleficence by promoting well-being while minimizing harm. Incorrect approach is analysis, an approach that solely focuses on aerobic activity, neglecting resistance and flexibility, is professionally unacceptable because it fails to provide a comprehensive strategy for diabetes management and may not adequately address the individual's overall physical well-being. This overlooks the significant benefits of resistance training for improving insulin sensitivity and muscle mass, and the importance of flexibility for maintaining joint function and preventing further mobility issues, which are crucial for individuals with both diabetes and osteoarthritis. This approach could be seen as a failure to provide evidence-based, individualized care as recommended by professional standards. An approach that exclusively recommends high-impact aerobic exercises and heavy resistance training without considering the osteoarthritis is a significant regulatory and ethical failure. This directly contravenes the principle of non-maleficence by potentially causing harm through joint injury or exacerbation of pain, and it demonstrates a lack of individualized assessment and planning. Such an approach would violate the CDC's responsibility to provide safe and appropriate care, potentially leading to a decline in the individual's physical function and adherence to the exercise program. An approach that prioritizes flexibility exercises to the exclusion of aerobic and resistance training is also professionally inadequate. While flexibility is important, it does not provide the same level of cardiovascular benefit or impact on insulin sensitivity as aerobic and resistance training. This limited approach would fail to optimize diabetes management and could lead to suboptimal health outcomes, representing a failure to deliver comprehensive and evidence-based care. Professional reasoning. When developing a physical activity plan for an individual with type 2 diabetes and osteoarthritis, a CD says should employ a systematic decision-making process. This involves 1. Conducting a thorough assessment of the individual's current physical activity level, diabetes status, including glycemic control and any complications, and the severity and impact of osteoarthritis on their joints. 2. Reviewing current evidence-based guidelines from reputable organizations like the ADA and relevant rheumatology or physical therapy bodies. 3. Collaborating with the individual to set realistic, achievable goals that consider their preferences, limitations, and potential barriers. 4. Designing a progressive, multimodal exercise program that incorporates low-impact aerobic, appropriate resistance, and flexibility exercises, with clear instructions on proper form and modifications to accommodate joint pain. 5. Providing ongoing education, monitoring progress, and making adjustments to the plan as needed, ensuring the individual's safety and promoting long-term adherence and improved health outcomes. Question 20. Research into the diagnostic criteria and typical onset characteristics of type 1 diabetes mellitus, type 2 diabetes mellitus, and gestational diabetes mellitus is crucial for a certified diabetes care and education specialist. Which of the following approaches best reflects the application of this knowledge in patient education? Option A. Focusing primarily on the genetic predisposition for type 2 diabetes, as it is the most prevalent form, and briefly mentioning other types. Option B. Providing general information on blood glucose monitoring and healthy eating for all individuals diagnosed with diabetes, regardless of specific type. Option C. Emphasizing the autoimmune destruction of pancreatic beta cells and the absolute insulin deficiency characteristic of type 1 diabetes, the insulin resistance and relative insulin deficiency common in type 2 diabetes, and the hormonal changes leading to glucose intolerance during pregnancy for gestational diabetes. Option D. Explaining that all forms of diabetes require lifelong insulin therapy and strict dietary restrictions. The correct answer is C. Emphasizing the autoimmune destruction of pancreatic beta cells and the absolute insulin deficiency characteristic of type 1 diabetes, the insulin resistance and relative insulin deficiency common in type 2 diabetes, and the hormonal changes leading to glucose intolerance during pregnancy for gestational diabetes. Explanation. This scenario is professionally challenging because accurately differentiating between the underlying causes and implications of type 1, type 2, and gestational diabetes mellitus, GDM, is fundamental to providing safe and effective diabetes care and education. Misidentification can lead to inappropriate treatment plans, ineffective self-management strategies, and potentially serious health consequences for the individual. The Certified Diabetes Care and Education Specialist, CDCES, must possess a deep understanding of the pathophysiology, typical onset, and management principles unique to each type to tailor education appropriately. The correct approach represents best professional practice because it demonstrates a comprehensive understanding of the distinct etiologies and clinical presentations of type 1, type 2, and gestational diabetes. This allows for the accurate assessment of an individual's condition, leading to the development of a personalized and evidence-based education plan that addresses their specific needs, risks, and goals. Adhering to established guidelines for diabetes management, which are implicitly part of the CDCES certification framework, ensures that education is aligned with current medical consensus and regulatory expectations for patient care. An incorrect approach that focuses solely on general diabetes management without differentiating between types fails to recognize the unique physiological differences and treatment pathways. This can lead to the provision of education that is either insufficient or inappropriate for the individual's specific condition, potentially delaying or hindering effective management. For example, providing type 2 diabetes education to someone with type 1 diabetes might overlook the critical need for insulin therapy and the management of autoimmune processes. Similarly, failing to emphasize the transient nature and specific risks of GDM to a pregnant individual could lead to inadequate monitoring and management of maternal and fetal health, which is a significant regulatory and ethical concern related to patient safety and adherence to standards of care. The professional reasoning process for similar situations involves a systematic approach. First, thoroughly assessing the individual's medical history, diagnostic results, and current clinical presentation to accurately identify the type of diabetes. Second, consulting current evidence-based guidelines and regulatory standards relevant to diabetes care. Third, developing a patient-centered education plan that is tailored to the identified diabetes type, the individual's learning style, cultural background, and personal goals. Finally, continuously evaluating the effectiveness of the education provided and making necessary adjustments.